Thank you for attending my presentation, Counseling the Neurodiverse, How Late Diagnosis and Self-Realization Impacts Autistic Adults. The reason I chose this topic is due to my specialization in neurodiversity affirming therapy, as well as my own late in life autism diagnosis. In fact, you'll likely notice that I'm reading from a script I wrote. That's because of the way autism impacts me. As you'll see, one of the traits of autism is a deficit in social communication. And there's no greater method of social communication than giving a presentation in front of people. And yes, I do have accommodations for this. The purpose of this presentation is to examine how receiving an autism diagnosis, or at the very least, self-diagnosing in adulthood, can impact mental health, identity, and access to care. Throughout this presentation, I will also explore why diagnosis in adulthood is so important after years of misdiagnosis and struggling through therapy, life, and relationships. It's important to note that language is also very important to the autistic community. While most professionals and society in general have been conditioned to use person-first language, which for other individuals with disabilities may be preferred, many autistics like myself prefer identity-first language because we cannot be separated from our autism. It is our identity because it makes us who we are. It's not an accessory that we can set aside. The preference of identity-first language by autistics was actually confirmed by a 2023 study of 723 US adults, where 87% of the autistic population in the study preferred identity-first language. Further, this is actually the preference when it comes to neurodiversity affirming therapy, because person-first language is pathologizing and deficit-based, and that's something that we as mental health professionals need to move away from. Finally, the publication manual of the American Psychological Association, 7th edition, states that either way is acceptable in writing or presentation. But it's important to ask the individual you're working with before you assume. In order to understand why diagnosis is important, we first have to understand what autism is and what some of the common misconceptions are. Autism was first included in the Diagnostic Statistical Manual Mental Disorders in 1952 as a trait of childhood schizophrenia. At this time, the DSM was about the size of a school notebook and didn't even include the word "of" in its title. This was actually changed with the release of the DSM-2 in 1968, when the title was also changed to the Diagnostic and Statistical Manual of Mental Disorders, 2nd edition. Although the manual essentially only doubled in size at that time, and autism was still considered a trait of childhood schizophrenia, autism wouldn't receive its official diagnostic entry into the DSM until 1980 with the release of the considerably larger DSM-3. At that time, autism was mainly a childhood diagnosis known as autistic disorder. In 1994, the DSM-4 was released, and with it came other diagnoses like Asperger's syndrome, pervasive developmental disorder, childhood disintegrative disorder, and others that would eventually be merged together into autism spectrum disorder with the release of the DSM-5 in 2013. As you can see on this side, there's a number of reasons how many adults manage to escape diagnosis in childhood, which for the sake of time, I won't reiterate, but you can read for yourself. The diagnostic criteria for ASD can be simplified into two categories: restricted repetitive behaviors and interests, and deficits in social communication. Notice how I didn't mention anything about intelligence or functioning labels, such as high functioning, low functioning, or profound autism. That's because functioning labels aren't included in the diagnosis, and most autistics detest these pathologizing functioning labels. To an autistic, these are up there with any other derogatory label used to separate individuals by race, culture, gender, or sexual orientation. So please don't use them. Instead, there are, however, levels of support needs such as low, moderate, and high support needs. These support needs are liable to change daily or even hourly, depending on how much an autistic individual is over or understimulated. Also, autism has nothing to do with intelligence. The media has promoted this idea that autism either means you're incredibly smart or you have the intelligence of a toddler. But this couldn't be further from the truth. Autistics have varied intelligence, just like allistics. For those who don't know, the term allistic means not autistic. Autism is a spectrum. It's not linear and looks more like a color wheel rather than a directional line where everyone's a little autistic. Also, many believe that people can look autistic, but autism doesn't have a look. While yes, many autistics are uncomfortable with eye contact and tend to heavily lean toward alternative subcultures and counterculture, as well as being part of the LGBTQ plus community, autism itself doesn't have a look. Historically, autism has only been recognized in middle class Caucasian boys, because those are the only ones that psychology has historically researched. But autism can be found in children, adults, boys, girls, men, women, Caucasians, and every ethnicity on the planet. It simply manifests in different ways due to culture and societal expectations. Finally, many believe that self diagnosis is invalid, but that can be further from the truth. The actually autistic community recognizes self diagnosis due to a lack of professionals being trained in performing autism assessments and diagnoses, as well as the extremely high cost of assessments. Because typically, older psychologists who've been in the industry for decades have a tendency to fixate on older diagnostic criteria and research rather than remaining up to date. There's a number of reasons why it's important for adults to be assessed for autism and receive diagnoses. Typically, undiagnosed autistics experience trauma across their lifespans, which can cause the development of anxiety disorders, depression, PTSD, and even personality disorders, specifically borderline personality disorder, or in some cases, obsessive compulsive disorder. Along with trauma, most undiagnosed and misdiagnosed autistics generally experience alienation from their peers and families, along with isolation. Feelings that there's something wrong with them, invalidation of experiences and sensory needs, and typically receive diagnoses that don't fully explain their understanding of themselves or make sense to them. However, when we receive our diagnoses in adulthood, we improve our understanding of ourselves, begin to accept ourselves, and are better able to find and receive resources specifically for us. A 2022 study examined the differences in emotional, behavioral, and social difficulties between early diagnosed and late diagnosed autistic children, and found that earlier diagnosed children experienced more emotional, conduct, and social difficulties, while the late diagnosed children experienced higher levels of emotional, behavioral, and social difficulties, were more often female with higher IQ and steeper growth and difficulties by age 14. Because of these differences, it's theorized that late onset of EBSDs affects when children are assessed and diagnosed with autism, and that earlier diagnosed children are more likely to receive a diagnosis of ADHD. Earlier this year, you might have seen a study out of Princeton that involved four distinct phenotypes of autism to determine if genetic variations influence specific phenotypic outcomes in autistic children. Researchers discovered four specific phenotypes in autism: social and behavioral challenges, autism with developmental delay, broadly affected, and moderate challenges. A primary finding was those with social and behavioral phenotype, as well as a moderate challenges phenotype, met developmental milestones similarly to non autistic children, yet still exhibit poor autistic traits, which in theory could explain why they weren't diagnosed in childhood. In 2020, a study performed to update and add to the research of autism and substance use diagnostic measures, examine the prevalence of co occurring conditions, and identify contributory factors of risk. The researchers reviewed autistic trait variables and different types of substances with 26 studies, but found no single prevalence rate. Could be determined due to highly varied findings, with an average quality score and prevalence rate due to variances in sample characteristics and diagnostic measures. To determine what factors predict mental health challenges in autism and how those outcomes evolve over time, a 2024 study performed a systematic search using terms related to autism, longitudinal nature, and mental health disorders between 2000 and 2023, as well as a review of duplication, relevance, and violations of inclusion. Researchers found that mental health challenges for individuals on the autism spectrum are consistently higher than their neurotypical counterparts, specifically when it comes to anxiety and depression. Earlier this year, Beckwith and Lopez performed a study to understand the lived experiences of autistic adults. They found that the individuals experienced poor mental health due to social isolation, difficulties recognizing autism symptomology, and struggling with communicating support needs, but also found improved mental health results after seeking support and receiving a professional autism diagnosis or self diagnosing. A 2017 study investigating the relationship between autism acceptance and mental health examined self reported experiences and using the social model of disability. Literature examining the rapid, unfavorable judgments non autistics make on autistics before knowing their diagnosis, with findings that demonstrated a prejudicial judgment of autistics by their allistic counterparts in all areas, demonstrating the bias against autistics, which may lead to increased mental health concerns, was also a focus. The study found that autism acceptance was associated with lower levels of depression and stress among autistic participants, demonstrating the importance of autism acceptance when it comes to mental health. To understand how late autism diagnosis may impact individuals' sense of self, mental health, and life narrative, this 2019 study involved interviewing 9 autistic adults who considered receiving an autism diagnosis as a positive step toward improving self understanding and their support needs. It revealed that participants had been aware of differences from their neurotypical peers due to social isolation and challenges throughout life, but were unable to make sense of it and express a mix of relief and grief, feeling validated by their new understanding while also mourning missed opportunities and confronting experiences of discrimination based on their autistic traits. Notably, one participant described how the diagnosis helped him identify overstimulation as a cause of anxiety, which enabled him to reduce his reliance on asthma medication. I greatly related to this. I found that after my diagnosis, I was able to reduce use on my asthma inhaler. To explore the lived experiences of late diagnosed autistic men, a 2022 study found 3 primary themes that emerged in participant responses. As you can see on this slide, participants often sought assessment after experiencing ongoing mental health struggles that escalated into crisis, or after recognizing similar traits in their own children. Finally, the impact of receiving an autism diagnosis in adulthood left many of the participants dealing with grief over what they never received in childhood, with many gaining several areas of positive impact also included on the slide. In an effort to analyze the availability and effectiveness of post-diagnostic support for late diagnosed autistic adults, a 2024 study was conducted that found post-diagnostic experiences were generally negative, with many participants reporting limited or having no access to support. You'll notice on this slide a multitude of findings came from this study. Those who did receive appropriate support, such as psychoeducation, reported more positive experiences and tangible benefits. I also connected with this study as I recently had clients who are very high support need autistics with a comorbid intellectual disability. And I attempted to use neurodiversity affirming therapy with them, but was unable to really get them to be productive in counseling. And when I attempted to find maybe an ABA, a neurodiversity affirming ABA therapy near me that could help them, there weren't any because they were adults and most ABA therapists specialize in children. So that really shows a lack of supports for the adult autistic community. To explore the barriers autistic adults face when accessing healthcare, a rare fully autistic-led study was conducted in 2023, where most of the researchers were medical doctors from the UK, US, and Ireland. Analysis found overarching barriers in a variety of areas, as you can see on this slide in bold. Expanding on Milton's 2012 double empathy problem, which states that autistics don't lack empathy. Rather, there's a social breakdown that occurs between autistics and non-autistic people due to a mismatch in communication style, perspectives, and worldviews, where not only do autistics struggle with understanding allistics, but the same can be said for allistics in their understanding of autistics, kind of like a Mac trying to communicate with a PC. The authors of a 2023 study propose a triple empathy problem to identify the additional cultural and communicative divide between autistic patients and non autistic healthcare providers. Researchers then introduced the Autistic Space Framework as a guide for improving autistic healthcare experiences. Each of the aforementioned studies had similar problems, so rather than repeating myself across each of these, I thought I'd just mention them here. The majority of these studies focused on Caucasian males, with a limited to no multicultural or gender neutral approach taken. Further, a few of the studies had a rather small sample size, which made for a good preliminary study, but not exactly representative of the population. Finally, some of the studies were based in either the UK or South Africa, and it leads one to wonder if the data can be transferable to represent the autistic community in other countries. The reason these studies are important is because they identify the experiences of late diagnosed autistics, how a late diagnosis may impact autistic mental health, identified several empathy problems, and showcase gaps in services for autistic adults. When taking this research into consideration, it's clear that typical mental health treatments aren't necessarily the right approach when it comes to neurodivergent clients. Pathologizing the autistic individual and taking a deficit based approach is a clear path toward making things worse rather than improving them. If we want to help the autistic community, we need to stop treating autism like a core feature of their problem. The problem isn't autism, it's how being autistic in an holistic society traumatizes neurodivergent individuals. There's a myth in the mental health industry and public that autism can and should be treated, which was discussed in a 2025 article by Anne Kronk, where many clinicians, families, and society in general believe that autism needs to be treated and even cured. This is even more evident if you consider recent claims by RFK Jr., which has been discussed in depth in the media. Applied behavioral health and applied behavioral analysis, also known as ABA therapy, is often introduced in childhood with the goal of reducing autistic traits that society views as undesirable, such as stimming. Although contemporary ABA has diverged into two broad approaches, one more aligned with neurodiversity affirming values, as presented by Rickman in 2025, and another that continues to rely on traditional behaviorist conditioning, as developed by Ivan Pavlov in 1903. Many autistic adults report that ABA can be experienced as harmful, primarily the older Pavlovian version, as discussed by Anderson in 2022. This raises the question, if services for children are primarily designed to enforce conformity, what meaningful supports exist for those who receive their diagnosis in adulthood? To answer that question, we first need to determine the part that identity plays in the diagnosis, as well as what mental health problems could occur as a result of not being diagnosed in childhood. So, why is diagnosis, or at the very least, self realization in adulthood, important if individuals like me have gone most of our lives without diagnosis? It's too late to really do any good, right? Well, it's true that autistic adults receive fewer accommodations than autistic children. And adolescents, there's a newfound sense of identity and understanding that comes along with a diagnosis that can improve the mental health of the individual. Even though those who are self diagnosed are unable to receive accommodations, many develop a newfound sense of identity, just as professionally diagnosed autistics do, which is why it's so important for mental health professionals to validate self identification in sessions. Understanding who one is can have a number of benefits, such as improved understanding of oneself and the ability of mental health providers to better help the individual in a neurodiversity affirming way. When one is looking to reach a destination they've never been to before, using a map is generally a good idea. Understanding one's neurodiversity is how professionals and individuals learn what map to use. Not all mental health treatment is created equal, and not everyone responds the same way to each type of treatment. Rutham Strun stated in her 2025 book, Cross Neurotype Consultation and Collaboration in Mental Health Care, will enable us to move forward with clarity and insight on the journey to providing neurodiversity affirming psychotherapy and far beyond. By naming and affirming autistic identity, clinicians create a shared language with their clients, which facilitates trust and helps clients feel seen rather than pathologized. When identity is acknowledged, therapeutic goals shift from normalizing behavior to supporting well being, which fosters collaboration and strengthens the therapeutic alliance. Affirming autistic identity in therapy counters the shame many adults carry from years of masking, enabling clients to bring their authentic selves into the therapeutic space. Thus, identity formation and therapeutic alliance are closely linked. When clinicians recognize and affirm autistic identity, they not only support clients' self understanding, but also deepen rapport, collaboration, and effectiveness of therapy. The neurotype of the individual impacts the lived experiences of the individual and how they react to certain situations. Autistic adults are typically marginalized, and that marginalization can impact relationships, not just with peers, but also in the mental health and healthcare industry. In her 2024 doctoral dissertation, Lana Andoni found past relational trauma is often experienced by autistic adults and highlighted the need for therapists to be aware of these unique relational challenges while supporting them and validating their experiences. Empathy is a powerful way in which many people socialize and develop relationships, which means there are a number of different empathy problems professionals need to be aware of when it comes to treating neurodivergent individuals. The first would be Milton's double empathy problem, as discussed earlier. The second would be Shaw's triple empathy problem. The triple empathy problem can also switch out healthcare provider with gender or race as well, such as a Caucasian allistic and a Black autistic, or male allistic and a female autistic. Research could potentially take the empathy problem even further by adding an and between those examples rather than an or, such as a Caucasian doctor and a Black female autistic, and so on. While some autistics are better at masking than others, there are those who choose instead to internalize everything. Often, this internalization leads to self-destructive behavior, such as isolation, substance abuse, self-harm, and even suicidal ideations, if not attempts, which can be difficult to overcome for an allistic neurotypical individual. But for someone who's autistic, it can be the only way they know how to survive. And thus, overcoming them can be next to impossible or even undesirable. Substance use, as studied in 2021, binge eating, which was studied in 2023, and self-harm, as studied in 2025, can be ways for autistics to stem and or cope. Neurotypical counselors are better able to understand these behaviors in neurotypical individuals and manage to provide effective treatment. But when it comes to autistic individuals, the neurotypical counselor may make little to no progress, as the reasoning behind such actions can be difficult for the neurotypical counselor to comprehend, which is why it's important for all mental health professionals to, at the very least, be informed about how whatever mental health disorder they specialize in is developed in the neurodivergent individual and the best way to work with said individual to help them. Prior research by Beckwith and Lopex in 2025, as well as Stagg and Belcher in 2019, suggests that adult diagnosis often leads to reduced anxiety and depression, improved self-understanding, and increased self-esteem by providing validation and the ability to interpret past challenges. By the same logic, adult diagnosis can help the autistic individual understand why they use the previously mentioned stems and coping mechanisms and find healthier ways to cope and stem. There's a clear link between autism being diagnosed in adulthood and emotional themes such as grief, relief, identity reconstruction, and reflections on past experiences like bullying, masking, trauma, and misdiagnosis, especially in adolescence. I learned in 2017, or in the 2017 study, as well as the 2022 study shown on this slide, these responses are often echoed on social media by those influencers who receive an adult diagnosis or even self-diagnose using as self-assessments, often provided by the website Embrace Autism, which was developed by Dr. Natalie Engelbrecht and Eva Silverton in 2018. The self-assessments used by Embrace Autism that seem to be the most popular are the Camouflaging Autistic Traits Questionnaire, otherwise known as the CAT-Q, the Ritvo Autism Asperger Diagnostic Scale Revised, also known as the RADS-R, the ASPE quiz, and the Autism Spectrum Quotient, or the AQ. Each of these assessments are backed by research and based on gold standard autism assessments, like the Autism Diagnostic Observation Schedule 2, otherwise known as the ADOS-2, which is considered the gold standard, or the previously used Autism Diagnostic Observation Schedule, also known as the ADOS. Understanding one's identity and neurodivergence can help with the double empathy problem, as well as other related empathy problems. Access to services, improved self acceptance, and finding one's own neurotribe, which was described by Silberman as a collection of individuals with similar neurotypes who bond and socialize. Many neurotypical counselors believe they have to treat the autism to improve the quality of life for the autistic individual. But as stated previously, autism can't be treated. Only the harmful behaviors and mental health symptoms of being autistic in an holistic society can be. It takes a special type of counselor with a certain understanding of neurodivergence to help those with an autism spectrum diagnosis. While most autism specialists still primarily work with children, there's a critical need for counselors who are equipped to support autistic adults, especially those diagnosed later in life. Through neurodiversity affirming therapy, trauma-informed approaches. For therapists, understanding the neurodivergent experience, validating it, and affirming the individual's identity can greatly improve rapport, trust, and help the therapeutic process. The core principles of neurodiversity affirming therapy are respect for differences, collaboration, focus on the individual's strengths and environment, as well as promoting self-advocacy. Therapeutic goals should not focus on masking, suppressing stems, and forcing typical behaviors, as these have been shown to worsen mental health. Instead, focus on building coping skills, self-regulation, and authentic self-expression. There are a variety of workbooks out there that adapt traditional therapies for neurodivergence. I often use the Neurodivergent Friendly Workbook of DBT Skills and the Autistic Burnout Workbook, which are often promoted by the autistic community. So here are my references. As you can see, there are a lot of them. And now, before I get into questions, I'd like to share with you the story of one of my own clients who has experienced a lifetime of trauma. This client is currently in their mid-20s and has been diagnosed with anxiety, depression, and many other disabilities. She came to me early in my practicum after a stay in our crisis unit. She has exhibited self-harm tendencies and suicidal ideations. She suspected early on that she was autistic with ADHD, but had never been able to receive a diagnosis. During our sessions, I provided her with a link to embraceautism.com, where she took each of the self-assessments I mentioned earlier, and they all came back stating that she had strong traits of autism. During our sessions, I performed neurodiversity affirming therapy and validated her experiences, as well as her belief that she's autistic. Through our time together, we explored her past trauma and how it was connected to undiagnosed autistic traits. This exploration helped her to begin to understand herself better and her newfound identity. Eventually, we were able to get her referred for an autism assessment. And at our last session on Wednesday this week, I was able to provide those results to her as having a positive autism and ADHD diagnosis, provided by the doctor we have on staff. And with this, she let out a scream of excitement and validation. Now I'll invite everyone to ask questions, and while you do, I want to showcase a follow-up slideshow video. I went to social media and asked the late diagnosed autistic community how they felt when they received their diagnoses. My own personal experience echoed these experiences of grief, relief, and understanding.
When working with clients one client that comes to mind for me is a client whose son is diagnosed, and through the process of having her son diagnosed, has recognized a lot of traits in herself. When working with clients who are exploring that possibility of diagnosis or self-diagnosis, as a neurotypical counselor, how can we best support them through that?
So that is actually very, very common. Most of the time, as I stated earlier, a lot of times adults will discover their own autism by way of their child's diagnosis. Um, we have to help them understand that if they seek out a diagnosis, they're not really going to receive a lot of accommodations unless they're in school. They may receive accommodations in the workplace. Um, So the benefits of receiving an official diagnosis may not be there for them. And since an assessment at the very least can cost between $1,700 to close to $7,000, you have to just kind of weigh the benefits and um, against everything else. And if they choose to instead take the self assessments and self identify, then just empower them, validate that, and just help them understand how that lack of diagnosis, especially in childhood, has impacted who they are today.
Thank you so much, Shannon, for this wonderfully organized, knowledgeable. You conveyed your knowledge and passion in this topic. I especially appreciated these quotes. I think it's really affirming and acknowledging the grief aspect, especially for folks who, you know, had an idea, a question, a puzzle about themselves, and I can relate discovering sort of my own ADHD after having a kid and later diagnoses. So I appreciate you kind of incorporating that aspect of folks like realizing this is what makes sense. And now I can have a language to describe what's happening to me and also how to speak up for what I need. Um, how do you see yourself kind of integrating this into your own professional niche work as you continue to work on your license and things like that?
I think I already have.
Nice.
I've kind of become the person that um, my coworkers kind of go to whenever they have an autistic client, or if one comes through um, in intake, um, because I have such an understanding and I have the life experience of being late diagnosed and not really being heard in childhood. Um,
Mhm,
I kind of tend to take on the majority of the autistic clients we have. So my
mhm,
caseload is getting pretty full. Um, and even if they don't have an autism diagnosis, I've learned to actually recognize a lot of the common comorbid diagnoses that could lead to a potential autism diagnosis. And
mhm,
generally, when I take those clients on, one of the first things that they bring up in our first session is I've often thought maybe I have autism or ADHD, but I've never really been diagnosed or assessed for it. And
mhm,
so then I guide them to embraceautism.com, and let them take the self assessments. And then we discuss like how that impacts their identity,
mhm,
their understanding of themselves, and if that makes them want to get a professional diagnosis, or if they're okay with just self-diagnosing their autism or ADHD. And I've actually found that a lot of individuals who have an ADHD diagnosis will eventually get an autism diagnosis. There is actually that relationship that is linear between autism and ADHD that's currently being researched, where you have autism on one end and ADHD on the other. And where you fall on that line is how much of each you have traits you have. So I just kind of provide a lot of psychoeducation to clients and
mhm.
let them guide the sessions.
Thank you. I really appreciate that. What other, I mean, you can tell that you're very knowledgeable and you've been developing this skill set in your clinical training. Your clients are benefiting from from that expertise, as well as I get that sense of your own personal experiences, how you've like infused that into your approaches. What other thoughts, questions does the group have? And Shannon, you're welcome to stop sharing your screen so we can see everyone's faces. And let's go ahead and give Shannon a big round of applause. This is a tremendous PowerPoint presentation.
I am not a future clinician, so my comment is going to be a little different. I'm an SSA and just wanted to come because I saw the nature of the presentation. I'm going to try to make it to as many as I can today because I find them so informative. My former role was a special education director of a middle and high school. And so a lot of this is feeling really sort of reaffirming of certain things and then bringing new information to my mind. And I really just appreciate, Shannon, how many times you came back to what the autistic community would prefer and the research that they've done and the norms that they've created. And you've created for yourselves. I think that's really important to include perspectives of the people actually impacted. And so I was very heartened to see all of that coming through in your presentation. And I have a suspicion that your clients also appreciate hearing things directly from community that shares identity with them. So not really a question, but just something I kind of noticed based on my past experience.
Thank you. I will share, since we got time, what led to my own personal journey to diagnosis. All through my life, I experienced a lot of these mental health struggles, depression, anxiety. There was a time when I had a lot of suicidal ideations. And I'd been misdiagnosed so much. When I was in fifth grade, I had a psychological assessment done, and the psychologist, this was right when the DSM-4 came out, so she was still functioning off of the DSM-3, and she actually said in her report, I was the reason I was being bullied in school. In my 20s, I experienced a lot of depression. The counselors I worked with diagnosed me with depression, anxiety, and even suspected bipolar type 2. And then in my 30s, my medical doctor diagnosed me with depression and anxiety. And it wasn't until one of my friends, we were at a cookout, and she noticed some traits in my son that really mimicked a friend of hers, son, who had an autism diagnosis. And she asked me if my son was autistic. And I was just like, I don't know. He's just Duke to me. Um, so that led to a discussion between my wife and myself and allowed me to research it. And I began seeing in the diagnostic criteria a lot of things that reflected my own experiences. And so it led us to getting an assessment scheduled for my son, which led to an autism diagnosis for him, because I didn't want him to grow up with the same problems that I had. And then that eventually led me to um, seeking out an assessment for myself. I had to actually go to, I think it's Illinois, ISU in Bloomington Normal. I always get them mixed up, either SIU or ISU. Um, but they do adult autism diagnoses and assessments, because um, their clinical students will actually perform it, and then they're signed off on by an actual psychiatrist. So I went and I paid the $1,400 that I really didn't have, but I needed answers, and spent an entire day taking their ADOS 2 assessment, and came back, and my I was validated. I received my diagnosis of autism spectrum disorder, and that just furthered my drive to study what autism was and everything else, and advocate for autistics, not just adults, but also children.
Thank you for sharing that, Shannon. It just goes to show that, the longer it takes to get that affirmation, the more complicated it could be potentially for that person, in processing what their whole life could have been like, if they had known this about themselves. And I'm wondering briefly, I know we have just a few minutes left, what do you think is the relationship between folks who've been diagnosed with more singular clinical presentations like anxiety or depression, and then later on getting this more holistic um, diagnosis of including autism, ADHD? What do you think is the relationship between those two in terms of affirming that identity and your experience of your previous experiences struggling with mental health? Am I making sense with that question?
Yeah.
And so, I think it improves their mental health once they receive the diagnosis and better understand themselves. Um, when it comes to those singular diagnoses early on, um, it really makes those of us who are late diagnosed wonder why this wasn't caught earlier, why we
Mhm.
were diagnosed with an alphabet soup worth of disorders, why clinicians aren't trained in identifying autism traits, not only in children, but in adults. Um, in undergrad and in this program, very little has been covered on autism. I mean, I took a neuroscience psychology class in undergrad, and as well as a special education class, and we barely touched upon autism in both of those classes. And once the individual realizes how little education there is in both graduate and undergraduate schools, they begin to ask questions: why isn't this covered more? And it becomes
Mhm.
more of um, they finally begin to understand themselves, but now they're wanting to advocate for better training for clinicians.
Mhm. I appreciate that. There still needs to be further, enhancements in what is included in the foundational training. And it sounds like a lot of these topics, that it's true for many topics in capstone, become passion interests after you graduate. It's hard to cover everything and go at the great depths in a program, but certainly more to be considered in how do we integrate these across the curriculum. So thank you so much, Shannon. Let's give one final round of applause.